Talking about dying can be very difficult, and people often avoid the subject, but it's a part of life that we will all have to face. As the end of life approaches for a loved one, it is understandable that you may feel apprehensive and have many questions. This video should help you to understand, anticipate, and respond to some of the signs you may notice. The first sign you may notice is decreased appetite and thirst. A common reaction is to want to begin using supplements and intravenous nutrition with the idea, it couldn't hurt. But research now indicates that the use of forced nutrition in terminally ill patients may actually worsen a patient's condition. Let me explain this. The digestion of food requires a level of energy that a dying person may just not have. One way even a healthy person may have experienced this is a growing nauseous feeling or even vomiting following an intense workout. During an exhaustive workout, the body reallocates resources such as blood and energy to the muscle groups and organs that require it the most. This leaves the digestive system with limited energy, thus frequently inducing nausea because it is unable to process the food at that moment. A dying person's body is also reallocating limited energy supplies to keep the essential systems of the body working. Because of this, their bodies lack the strength to digest food, thus making the presence of that food or fluid painful or even intolerable. Most of us can hardly imagine going for more than a day without eating. The dying, however, typically do not experience discomfort associated with not eating or even dehydration, besides possibly a dry mouth. Once dehydrated to a certain degree, the brain frequently releases endorphins that block many pain receptors, a kind of built-in painkiller system. Artificial nutrition, on the other hand, can induce a form of false hope for the body, allowing it to continue to fight to stay alive. A painful, hopeless fight that typically only prolongs the dying process. In the days before a person dies, the heart is no longer able to pump the blood effectively throughout the body. In an attempt to preserve oxygen delivery to the brain and heart, blood is shunted away from the extremities and non-vital organs, such as the feet and the hands. This may lead to cold and mottled extremities from where it then travels up. It is not painful, but giving the patient an extra blanket may help keep them warm. Research shows that this occurs late in the dying process and is a cardinal sign that death will occur within hours to days. A third sign you may notice is a changed breathing pattern. As the body is dying, respiration progressively becomes a solely involuntary act controlled by the brainstem. This means that the breathing pattern is reflexive and no longer a response to conscious awareness. Breathing becomes less regular. There might be periods where a person may not breathe at all for as long as 10 to 20 seconds. They are not a desire or hunger for air, but rather a basic reflex of the dying brain. This final or agonal breathing pattern is also called fish out of water breathing. It is an ineffectual gasping of the mouth with little or no actual air intake and signifies that death is very near. On top of this irregular breathing pattern, you may also hear a kind of gurgling sound every time the patient breathes. This is because swallowing becomes more difficult and secretions may pool at the back of the throat. These accumulated fluids may cause a noisy breathing that is known as the death rattle and sounds like this. You also may notice that a dying patient sleeps a lot. This can be distressing for relatives, but it's important to understand that physical exertion for someone approaching death is exhausting. And for the moment, all effort is being put into staying alive. Nearer the end, the patient may transition from sleeping many hours to diminishing consciousness and then coma. The fifth and final sign is incontinence. When we're alive, our brain is constantly sending signals to tell different parts of the body what to do. At the end of life, these signals stop and our muscles relax. The bladder and the sphincter are in a constant state of contraction, so when there are no more brain signals to the bladder or bowels, they will relax. And this is why it is not uncommon just before or after death for incontinence to occur. Thank you so much for watching this video. If you liked it and you want to see more of my educational videos, please consider subscribing to my channel.